Hello everyone, this is Dr. Cui. So in this video, I would like to discuss another commonly asked question: how will your uh, previous work experience make you a better physician? So actually, the interviewer just want to know your previous experience and also probably the specific time your work related to the clinics, those experience to see that if you have a good ability to work in their program, and also they want to know more about your clinical experience as well. And actually, in order to answer this question, you can specify one of your story during clinical rotation or any related experience, and also you can tell them what you learned from that experience, and uh, and also you can tell them uh, during that experience, what kind of experience is that? So, for example, if you did a rotation, yeah, if you complete residency training in your home country, you can tell them uh, what kind of program you joined and what you learned from that, and what did you do during the rotation. You can tell all of those details to them. So I'm going to give you an example for my question. So, Dr. Cui, can you tell me what's one of your previous clinical experience? I know you have completed your residency training in your home country. Can you tell me a little more about that? Yes, of course. So actually, that's the clinical training I joined in my home country is a very solid clinical training. During the training, I rotated in different departments, including cardiology, GI, hem-onc, and as well as other department that are related to the internal medicine. And also during the training, I learned how to collect the patient history, how to communicate with the patient, how to do the physical examination to the patient, and also I learned how to use their EMR system and how to deliver the treatment to the patient following my supervisor's instruction. And apart from that, I also did a lot of procedures, including Foley catheter replacement, central vein catheter replacements, as well as a blood collection, including venous arterial blood collection, and I even did the bone marrow biopsy in the hem-onc department. So and also I also taught the medical student all of the clinical knowledge and procedures I learned during the rotation, and and uh, so I think that so to be honest, I all of my clinical skill and the knowledges I acquired during the rotation is really helpful. And you can see that when I was doing rotation in New York City, I also taught my younger colleagues, my friends of this knowledge and skills, and also my attending, and also after they know that I completed um, the internal residency training in my home country, they even allow me to help them to educate the patient before and after their procedures, and also ask me to prepare for the anesthesia for their procedure in like intravenous ablation procedure. So and also they even ask me to taught their students how to read the EKG and how to draw blood easier from the old patient. So I would say that I really had a very solid clinical training and during the residency during the residency training I was in my home country. So you can see that in my answer, I give them a whole picture that what I did during my clinical training in China, and also I give them him a lot of details about that, what knowledge I learned, what department I rotated, and what the procedures I did, and what else I did, like including taught other students in the clinic, and also I mentioned that based on this experience, I did pretty well I was doing rotation in New York City in the United States. So so actually this will give the interviewer a very colorful story of mine and a colorful experience of mine. So I hope you will also get something from my story. And good luck.